How emergencies interrupt services. There are a lot of services we rely on in our communities. We need these services to live in the community and stay safe. These can include running water, electricity, public transportation like buses and trains, medical response like ambulances and emergency rooms, public walkways and roads to get around. Services that we pay to get that are very important are called utilities. Running water and electricity are types of utilities. Emergencies interrupt these services. We can lose electricity when there's bad weather. If something bad happens to the water or our pipes, we can lose running water, or it might not be safe to use the water we do have. A lot of emergencies can make it dangerous to use the roads. When roads are too dangerous to use, we lose services that use the roads. This can include public transportation and medical responses. When a service is interrupted, it is hard to stay safe. Losing access to these services can be dangerous. It can even be life-threatening. Some places already have trouble getting services. Sometimes a community already doesn't have them. Sometimes they already weren't reliable before an emergency. Less money is spent on services for poorer communities and communities of color. This makes it harder to keep those services running. There is less access to these services even before emergencies. These communities are more likely to lose services during emergencies. One example is losing electricity during blackouts. Many emergencies can cause blackouts. Some examples of emergencies that have caused blackouts are hurricanes in places like Texas, Florida, Louisiana, and Puerto Rico. Ice storms like the one in Texas in 2021. Wildfires in places like California. When we lose power, it can be very dangerous. If we need electricity for medical devices, we can lose use of those devices. If we use electric devices to move or speak, we lose that ability. We can lose our independence and access to our communities. If we take medicine that needs to stay cold, losing electricity can ruin the medicine. If we use electric devices to help us breathe or to give us medicine, we can get very sick or die. In 2021, Texas had a very bad ice storm. A lot of people in Texas lost electricity. A lot of people died. A lot of people who died couldn't stay healthy without electricity. We still don't know exactly how many people died. We didn't get good information on why people died during the ice storm. We don't know how many people died because they didn't have electricity. But we can compare the Texas ice storm to years when there's no ice storm, and we know that hundreds more people died during the ice storm emergency. A similar thing happened in Puerto Rico in 2016. In 2016, Puerto Rico had a very bad hurricane. Puerto Rico's electricity system was very old and not in good condition. A lot of people in Puerto Rico lost electricity when the hurricane happened. A lot of people died. Some people died during the hurricane, but a lot more died later in the months after the hurricane. For a very long time, we were not told how many people died after the hurricane. A lot of people died because they couldn't stay healthy after losing electricity. A lot of people had to leave their homes completely. They had to find places that still had electricity to survive. Losing services hurts poor communities worse. It hurts communities of color worse. This is because they do not have as much money. It costs money to prepare for emergencies. It can sometimes be very expensive. People without much money cannot afford to prepare for emergencies. It can be even more expensive for people with disabilities to prepare for emergencies. But it's harder for some people with disabilities to save money. Some people with disabilities use SSI. SSI is a payment that a lot of people with disabilities rely on. But in order to get SSI, you can't have very much money. If people who get SSI earn too much money, they lose SSI. They also lose SSI if they save too much money. The amounts of money people are allowed to earn or save on SSI is very low. It isn't enough to move to a new home during an emergency. It isn't enough for people to prepare for emergencies. Some people with disabilities have other problems preparing for emergencies. We can run out of medicine during emergencies. It can be hard to get extra medicine before emergencies. There are laws that allow pharmacists to give you extra medicine in an emergency, but every state's laws say different things. It is hard to know what the law in your state is. Sometimes, even pharmacists don't know the law, so they don't give extra medicine in emergencies. Sometimes the extra medicine doesn't last as long as the emergency. Sometimes the law says that some medicines can't be given out this way. It can also be expensive to get extra medicine in an emergency. Most state laws only say Medicaid has to pay for extra medicine in emergencies. Medicaid is a type of health insurance run by the states. If you have different insurance, you might not be able to get extra medicine. Medicaid is not available to everyone. Some states limit Medicaid. In these states, only people with the least amount of money get Medicaid. A lot of people who need help paying for medicine can't get it. In these states, many people with disabilities do not get Medicaid. This means a lot of people who need extra medicine for emergencies do not have Medicaid, so they might not be able to get extra medicine. Many people of color with disabilities do not have Medicaid or other insurance. Many people with disabilities cannot afford to get extra medicine for emergencies. Brought to you by the Autistic Self-Advocacy Network.